have a very important message for you today. I hope you are all fine. So I'm going to be getting straight into this video. Okay, so I'll be looking here because I've jotted some points over here that I'll be discussing with you this very evening. Okay, so we all know that our brain is very important and essential because it helps us to think and bring out solutions. But then this is a point where sometimes as our bodies can get ill and sick, the same thing happens to our brain. Our brain can also get ill and sick anytime of the day. But this when this happens, it becomes quite difficult for people to think clearly, and this is known as Alzheimer. Many are the time that most of the times people confuse themselves with Alzheimer's disease and dementia actually. But in this video, I'm going to be outlining and explaining very well to you what exactly Alzheimer's disease is and what exactly dementia is. Okay, so before we get into this video, I would like to make you aware that this video is just for educational purposes, not to diagnose anybody of any disease. It would be very advisable to seek for medical attention from a health practitioner. Don't use this video to diagnose yourself. It's just for educational purpose. Okay, so back to what I was talking about, Alzheimer's disease. So take your brain, let's say your brain, and it's been attacked. That attack is the Alzheimer's disease, and the person begins to forget things a lot. This is how Alzheimer's disease begins. So the person tends to forget things a lot, and they begin to even forget people they know already, people they are familiar with. Thank you for joining. Thank you very much. They begin to forget people they are familiar. So I'm talking about Alzheimer's disease. What actually happens when people get Alzheimer's disease? So the first thing I'm talking about is that. So hi, I'm talking about Alzheimer's disease, and I'm saying that most at times people who get Alzheimer's disease tend to forget things a lot, especially where they place their keys. And normally, let's say they really knew how to cook a certain kind of food since childhood, but then all of a sudden they begin to forget how to cook that particular food, the recipe associated with the food, and even how to turn on the stove. They tend to forget all those things. It can be a sign of Alzheimer's disease. So that is what I'm talking about over here. So please like this video and please subscribe to this channel so that you can get more health tips. So I'll be looking here because I have jotted certain points over there that I'll be discussing with you over here. Thank you all for joining. I'm very, very grateful. Okay, so most of the time they tend to forget familiar places, places they've even been to. They begin to forget those places and they get lost in their own neighborhoods. They begin to forget people that they even know, their own family members. They tend to forget their names. This is how the Alzheimer's disease can actually be. So, what I want to actually add to is that it's not only the person affected with dementia, with Alzheimer's disease, who is disturbed, their loved ones also tend to be disturbed. Why am I saying this? It is because a person being affected with Alzheimer's disease tends to make their family members quite frustrated, quite disturbed. That's it. So it's not only the person who is affected with dementia with Alzheimer who tends to be disturbed. Their family members and loved ones also tend to be disturbed. So please don't forget to like this video so that a lot of people can be sensitized on what Alzheimer's disease and dementia is, the difference. Okay, so the next thing I have over here is what dementia actually is. So dementia is a group of symptoms. Please, I hope you are getting me. Dementia is a group of symptoms, and Alzheimer is a symptom from dementia. So it's like dementia is the broad spectrum over here. Dementia is the big billboard over here, and Alzheimer is inside. It is a sub. Do you get me? So please, I hope from this video you are going to be getting the difference between Alzheimer disease and dementia. Please, I hope I can continue. Please give me a hello so that I will know that you are following what I'm saying over here. And please don't forget to subscribe to this channel so that you can get more information about health. Okay, so I'm moving on. So dementia being the big broad spectrum over here and Alzheimer being under it. Alzheimer is not the only symptom under dementia. We have other diseases under dementia, like we have the other diseases like blood vessels in our brain, types of dementia which happens with the blood vessels. I think it's called vascular. Sorry, I'm so sorry. So apart from Alzheimer's disease, we have other diseases associated with the brain. Apart from Alzheimer's disease, we have other diseases under dementia, but today we are going to be talking about Alzheimer's disease specifically. So let's continue with that. So with Alzheimer's disease, there are other hello. I don't know how to pronounce the name. Prajita Sumesh. Hi, keep smile. Thank you very much. Thank you very much. Please kindly subscribe to this channel and like this video as well so that you can get more of my health tips. Okay, thank you very much for the compliment. Okay, so I'm talking about the stages of dementia. So we have three stages of dementia, which I'm going to be discussing with you this very morning. So with the stages of dementia, so with the stages of dementia, Okay, so the stages of dementia, as I said earlier, there are three. So the first stage is the early stage, the second stage is the moderate stage, and the third stage happens to be the last stage. So we are going to be taking each stage one after the other to discuss what dementia is. Hi, Pajita. Please, I hope I'm mentioning your name very well. I hope I'm mentioning your name very well. Please, thank you very much for reacting to this video, for letting me know that you are following. Thank you very much. I'm very grateful. Please don't forget to subscribe to this channel and like this video as well. Okay, so with the first stage, that is the early stage, people tend to forget certain little things like how to cook certain recipe. Hi, Lee. Logan Lee, Hosby. Please, I hope I'm mentioning your name. I'm very sorry if I'm not mentioning the name very well. I'm very sorry. Hi, Lee. Thank you for joining us. Thank you very much. Hello, Josu. Thank you for joining. Please like this video so that it can get to a lot of people so that most people will be sensitized. Thank you, Lee. Please subscribe to this channel so that you can get more of my health tips. Thank you very much. Thank you. Thank you. Thank you. Thank you. Okay. Padrita says, um, you are very busy. Thank you very much. Thank you. Lee, I have subscribed. I'm very grateful. Thank you, Lee. Thank you very much. I'm very grateful. Okay, so I'm continuing with the stages. So the first stage, as I talked about, is the early stage. So with this early stage, people tend to forget most things that they've been doing over time. Yes, like cooking, switching on stove, they tend to forget those things, and it's very, very sad. That's one, the first stage. That's what comprises of the first stage. Okay, they also tend to forget names of people around them. That is the early stage of dementia. Okay, so now moderate stage, that is the next stage I have over here, moderate stage. So with the moderate stage, symptoms tend to worsen. That is about the moderate state. And people tend to forget certain activities that they used to do and familiar places they've been to. They tend to forget all those things. That is the moderate state. Moving on to the last stage of dementia. Well, the last stage of dementia, it tends to be that the symptoms becomes very severe. That is with the last stage of dementia. So with the last stage of dementia, people tend to need help from others with almost everything they do. They tend to need help with almost everything that they do. And also, maybe with things like bathing, cooking, going to the washroom, they would always need help from people. That is what comprises of the last stage. So now we are moving on to the causes of dementia. What actually causes dementia? What at all? Why dementia? So research from the research I've done, we don't really know what exactly causes dementia. That's it. We don't really know exactly what causes dementia. But then with certain combination of genetics, lifestyle and environmental factors, we can figure out what exactly may be the cause of dementia, but we don't really know what causes dementia. Okay, so the next thing I'll be talking about is certain risk factors that put one at a risk of getting dementia. What at all might put someone at a risk of getting dementia? So the first risk I'll be talking about here is age risk. Age. So when people reach certain age, they tend to forget a lot of things at certain age, especially around 60, 65, thereabouts. People tend to forget a lot of things. And also genetics, certain genetic mutations can also be one factor or risk of getting Alzheimer's disease. And please, this video is just for educational purpose, not to diagnose. So if you are finding any of these symptoms occurring to you, it would be very advisable that you talk to a health practitioner. Okay, so moving on, family history. Family history can also be one reason why maybe somebody might be experiencing certain symptoms of Alzheimer. That is forgetting certain things that they used to do. The next thing I have here is lifestyle. So normally having a sedentary lifestyle, like you don't, you are physically inactive, you don't walk, you're always in the house. Even being in the house, you don't do a lot of exercise, you can be at a risk of getting Alzheimer's disease. And also your diet, the things you eat. So you can check out my YouTube channel. I have made a video on certain foods that you can eat to prevent Alzheimer's disease. I've made a video on that. So please, you can check that out on my YouTube channel. Very good. Okay, so the next thing I have here is environmental factors. So with the environment, being exposed to certain chemicals, certain toxins, certain pesticides, and other stuffs can also be a risk of getting Alzheimer's disease. Being at a risk of getting Alzheimer's disease. So research has also shown that people who are normally exposed to these chemicals can be at a risk of getting Alzheimer's disease. Okay, so please drop a hi or hello so that I'll get to know that you are following whatever I'm saying over here. Okay, so now let's talk about certain diagnosis of Alzheimer's disease. The diagnosis, how are you going to know whether the symptoms that is occurring to one may be Alzheimer, may be as a result of Alzheimer's disease. Okay, so one thing is that we don't really have a specific diagnosis for Alzheimer's disease. Like maybe we are sticking to this particular diagnosis to show that if this particular diagnosis turns out, it means that no, it's a combination of different tests to show that. So it's a combination of different tests. That is what Alzheimer disease diagnosis is. So the first diagnosis we have here is medical history. So the doctor is going to be talking with you. Pajita, please. Hi. Thank you for letting me know that you are still following. So thing about one diagnosis is medical history. Yes, so the doctor is going to be talking with you. The doctor is going to let you know and ask you more questions about your previous medical history, what maybe the illness that previously maybe you've been ill. The doctor wants to know more about your medical history. The next one I have here is physical examination. So the doctor is going to examine you physically to know any signal of illness. The next thing is laboratory test. So the doctor is going to run certain lab tests, and get to know which medical conditions that may be affecting you. The next thing we have here is cognitive test. So when we say cognitive, the word cognitive is related to your ability to think, your ability to understand, your ability to solve problems. That is one That is what cognitive actually means. Okay, so the cognitive test. So the doctor is going to be running certain cognitive tests to know how you're able to pay attention to certain things, how you are able to pay attention to information, how you're able to solve problems. Now, the next thing is neuropsychological test. So the doctor is going to run certain neuropsychological tests, how you are able to pay attention. As I said earlier, that's also one test. So diagnosis of Alzheimer's disease is not based on one particular test. It's a combination of different tests altogether. Okay. So now let's talk about the treatment of Alzheimer's disease. How are we going to treat Alzheimer's disease? But the thing is, we don't have a specific treatment for Alzheimer's disease. That's the whole truth. We don't have a specific, like, if you're able to do this specific thing, that's it. No, it's a combination of different styles. So one thing is having a moderation or moderating your lifestyle. So moderating your lifestyle, yes, that's one thing. So looking at your diet very well, taking good care of yourself, they are all parts. Physical activity, not being inactive, be active. Do you get me? So physical activity, be active physically. And the next thing I have here is medications. So if you're able to go by the medications that have been prescribed by your doctor, you can manage Alzheimer's disease. That's one thing about solutions or treatment to Alzheimer's disease. One, medications, sticking to your medications, and two, um, what did I even say? And two, lifestyle moderation. So you look at your lifestyle, change, maybe you will have to change certain things about your lifestyle. Maybe you are not doing something right. Probably you might be eating certain foods that may be causing or maybe helping you get that Alzheimer's disease. So as I said earlier, I have a video on my YouTube channel where I talked about what kind of foods you can eat to help prevent Alzheimer's disease after 50 years of age. Okay, so please, I hope you are all finding this video helpful. Please give this video a like and also drop a comment down below. Let me know that you are following this video or this discussion. Okay, so one may ask, what must you do? What exactly should you do if a family member or if a loved one happen to get Alzheimer's disease? So the first thing I would say is that encourage the person to talk or see a health practitioner. Encourage the person to see a doctor because Alzheimer's disease is a serious disease that has to be dealt with. You can't deal with it all alone. You have to talk to a doctor so that he or she can help you out. The next thing I have over here is offer support and care. So if a loved one happen to get Alzheimer's disease, this is not the time to shout at the person. This is not the time to insult the person. This is not the time to say all sorts of words to discourage or put the person's spirits down. No, this is the time to care for them. This is the time they need your care. They need your support at this time. So it is important to offer all you can, all your support to help any loved one or any family member who maybe one way or the other has gotten Alzheimer's disease. Okay, so the next thing I have over here is, and also with the help, you can help them with their cooking, with their bathing, and that can also be a way of helping them. The next thing I have here is encourage them to engage themselves in social activity. Let them engage themselves in social activities. They shouldn't have a sedentary lifestyle of staying at home all the time, not going anywhere. No, they have to be active because being active is also one thing that's going to help prevent Alzheimer's disease. And as I said earlier, being inactive can contribute to a risk of getting Alzheimer's disease. So encourage them to engage themselves in social activities. Encourage them to be active. And next here is seek support for your own self because taking care of people with Alzheimer's disease can be challenging sometimes, honestly. It can be challenging sometimes. But then with support, seeking support from other people, you can actually take care of them without it being too challenging. So it is important to seek support from people so that you can take care of them. And I hope you are still finding this video or this information very helpful. Note that Alzheimer's disease is manageable if only you are able to go by what your doctor has told you to do. Maybe your doctor has given you this particular medications. Make sure you follow that particular medication, and it's going to go a long way to help you. I hope you found this video helpful. I hope you found this live video helpful. Please, you can check out my YouTube channel for more health videos, and don't forget to subscribe to this channel and like this video as well, so that it can reach out to most people and most people can be sensitized on this particular disease. Have a nice day. I'm very grateful for you all joining. I'm very grateful that you all joined this particular discussion. Thank you, and don't forget to like this video and subscribe to this channel. Bye.